Let's talk about chronic pain and opioid medications. People have asked how we can help someone who's been on opioids for a long time manage both their pain and the risk of dependence. So let's break this down. First, long-term opioid use can create a real challenge. On one hand, opioids relieve pain, but over time, the body adapts to them. That's called physical dependence. It doesn't mean someone is addicted, but if they stop suddenly, they can experience withdrawal. So what can be done? Well, this is where the care team steps in. A doctor might suggest adding non-opioid pain medications, like NSAIDs or medications for nerve pain, to the patient's treatment plan. Once the pain is better managed with those, the doctor might start tapering down the opioid dose. The key is tapering slowly and under supervision. Quitting abruptly can be unsafe. Now, what about preventing dependence in the first place? This is where careful assessment tools and good planning come in. Doctors may use tools like the opioid risk tool, check the patient's history, and use prescription monitoring programs to guide safe prescribing. They avoid opioids when possible for chronic pain and want to give them for the shortest period possible. There are also newer medications available now. One example is a sodium channel blocker recently approved by the FDA called Jernavix. It targets pain at the nerve level but without the addictive potential of opioids. That's promising for the future of pain care, and if someone's already highly dependent on opioids, they're not out of options. Doctors can help them transition to safer treatments like NSAIDs, muscle relaxers, SNRIs, or TCAs, which are antidepressants that also help with chronic pain, neuropathic pain agents like gabapentin, low-dose naltrexone, or the sodium channel blockers we just mentioned. In some cases, medications like methadone or Suboxone may be used under close supervision to help stabilize and manage opioid dependence during the transition process. The big picture here is this: people living with pain deserve safe, effective options. Managing pain and reducing opioid risks is possible, but it takes teamwork, time, and careful planning. And none of this should ever be done alone. If you or someone you know is dealing with chronic pain and has questions about medications, the best step is always to talk with your healthcare provider.